Okay, good morning, everyone. My name is Sean Slusarski. I am a doctoral candidate in theological ethics here at Boston College. I also teach medical ethics at St. Anselm College in New Hampshire. Our next session will focus on theology and social ethics. Our first presenter is Michael McCarthy. Michael McCarthy is an associate professor and director for the graduate program in healthcare mission leadership at Loyola University, Chicago. He is also a member of the Ethics Committee and Ethics Consultation Service for Loyola University Health System and has published widely in the field of healthcare ethics. His presentation is entitled Interpreting Jesus's Healing Ministry at the Intersection of AI and Health.
AI is already changing and transforming the way in which healthcare is delivered. However, the question remains open as to whether that transformation will further the aims of healthcare and caring for patients, and how that transformation aligns with the distinct values of Catholic healthcare. This paper draws on Jesus's healing ministry by emphasizing the importance of responding to human suffering through mercy. I'll first describe Jesus' healing ministry as understood through the Gospel of Mark. Second, in light of Mark, Jesus' healing can be seen as rooted in mercy, which provides a helpful hermeneutic to analyze the role of AI in Catholic healthcare. And part 3 of the paper describes the type of AIs within healthcare and offers a framework for discerning its implementation. Mark's Gospel, written in around 70 CE, offers the earliest surviving account of the Gospels of Jesus's public ministry and death. The stories in Mark's Gospel offer vivid accounts that try to place the reader in the scene. In Mark's Gospel, Dan Harrington and John Donahue note that the miracle stories occupy more verses, over 200, than the Passion narrative. The healing miracles form bookends of Jesus's ministry. The first healing follows Jesus's baptism and concludes with the healing of Bartimaeus, immediately preceding Jesus's entrance into Jerusalem. Edwin Broadhead notes that, quote, the Gospel of Mark avoids the Christological dichotomy between the Jesus of the miracles and the Jesus of the cross. Instead, the narrative grammar constructs an integrated portrait. Jesus is the powerful proclaimer whose wondrous teachings lead to his death, close quote. In Mark, Jesus's mighty deeds are integral to his roles of prophet and Messiah. Although exorcisms are the most prominent of these mighty deeds, healings are also a part of Jesus's prophetic and messianic activity. What is distinctive in Mark's telling is the emotional response of Jesus in the midst of his mighty deeds, utilizing a Greek term for mercy or compassion that unites the physical body with the human emotion. This term, splanchnizomai, occurs in connection with at least one exorcism, and perhaps a second, as well as miraculous feeding stories of Mark 6 and Mark 8. The word comes from a noun, splanchnon, which refers to the vital organs of a human being or animal. Over time, this term came to mean compassion, and Mark employs it as a verb applied to Jesus. While there are other Greek terms for mercy, eleos, for example, Jonathan Bryant has argued that splanchnon-related terms did not seem to carry the power differential between giver and recipient that was inherent in the use of and seems to have risen out of a desire to describe a deep somatic emotional response to the pain and suffering of others. Bryant argues that the force of this particular Greek term for compassion contributes to Mark's overall portrayal of Jesus. Quote, the stories of Jesus's miracles recounted throughout the first half of the narrative reveal not only that Jesus is the powerful agent of God's kingdom, they also reveal one who enters the pain and suffering of humanity, feels with and for them, and serves others in compassion and love. As an example, Bryant considers the request of the father whose son is unable to speak due to a spirit in Mark 9. This father begs Jesus to have compassion on them. Drawing on the work of F. Scott Spencer, Bryant notes that this is a plea from the emotional depths of the father to the physical and emotional depths of Jesus. While the focus of Jesus' mighty deeds can center on the power of the miracle worker, Mark places special emphasis on the human connection between Jesus and the recipients. This connection is both embodied and emotional. Jesus' healing miracles in Mark center on human encounters with other and demonstrate a willingness to engage in the life of those suffering. In each narrative account, there is an implicit or explicit request for Jesus' help. The leper begged him. The friends of the paralytic opened a roof to lower him down. The hemorrhagic woman touched his cloak while Jesus was responding to Jairus' request to heal his daughter. The clearest example might be the healing of the blind Bartimaeus. Jesus, upon hearing his call for pity, hear Elios, mercy, Jesus asked, "What do you want me to do for you?" And he is given his sight because of his faith. In each account, Jesus does not participate in the healings at a distance, but touches, speaks with, and accompanies those who suffer. The healing narratives in Mark's gospel connect the reader to the way in which Jesus recognizes and responds to the suffering of others that restores wholeness and one's place in society. Rather than demonstrating Jesus' power over suffering, they instead offer an insight into how Jesus as a human being enters the suffering of others and responds and challenges others to respond in merciful compassion. Mercy in Scripture is most often associated not with Mark's gospel, but with the story of the Good Samaritan. However, Jesus' actions in Mark convey the type of mercy that Jesus calls his followers to imitate in Luke's gospel. After the Samaritan responds to the victim on the side of the road, Jesus tells his disciples to go and do likewise. This type of mercy comes from within and moves one towards an outward response. While the stirrings of mercy may come from God's grace, the response is one that results in human action. Aquinas' discussion of mercy points to this intersection of grace and response. Aquinas discusses mercy in question 30 of the second part of the Summa, and he describes it as a virtue that unites humans to God in charity through human action. Aquinas concludes question 30 by stating, quote, "Hence, as regards man who has God above him, charity which unites him to God is greater than mercy, whereby he supplies the defects of the neighbor, but of all the virtues which relate to our neighbor, mercy is the greatest, even as its acts surpass all others, since it belongs to one who is higher and better to supply the defect of another, insofar as the latter is deficient." Close quote. From this description, mercy is a relationship between unequals, one in need and one who is able to respond. For Aquinas, it is when responding to the suffering of another out of love given to humans by God that mercy serves as the greatest virtue in connecting to one's neighbor and oneself. What constitutes an act of mercy, however, can remain somewhat nebulous because it is frequently connected with other terms. Aquinas uses mercy in connection with sorrow, sympathy, misericordia, compassion, pity, and justice. Rather than thinking of mercy as a thing in and of itself, it is best considered as the origin of an act, like in the healing narratives, that allows one to respond to the experience of the other's suffering. Mercy at its core is relational. It reinforces the reality of human interdependence between one neighbor and oneself. Contemporary discourses on mercy have drawn attention to both the suffering experienced by individuals and particular communities that experience suffering rooted in injustices and inequalities. Pope Francis emphasizes the importance of turning to mercy as the way human beings experience God's love. Quote, "In mercy, we find proof of how God loves us. He gives his entire self, always freely asking nothing in return." Francis echoes both the experience of awe felt by those who were healed by Jesus and reinforces the connection that Aquinas makes between God's love and the demonstration of mercy between human beings. Pope Francis calls attention to those who experience suffering in the world and who are denied dignity. Beyond just acknowledging their experience of suffering, he encourages, quote, "May we reach out to them and support them so that they can feel warmth of our presence, our friendship, and our fraternity. May their cry become our own, and together may we break down the barriers of indifference that too often reign supreme and mask our hypocrisy and egoism. Close quote. Francis' sentiment recognizes through mercy a sense of solidarity with others. Mercy is about doing something for the one that suffers and doing so in a way that demonstrates the connection between one another. Mercy, therefore, is the greatest of the virtues in relating to one's neighbor, is attentive to suffering of others, and responds to that need in a way that, as Jim Keenan describes it, enters into the chaos of the other. Keenan captures what Pope Francis means when he says, quote, "May their cry become our own." Quote, "Mercy calls us to meet human beings in need. By meeting them, often we realize that their situation is compromised. In the real merciful engagement, we realize that by entering into the chaos of others, we eventually have to face what causes that chaos. But usually, we cannot know about those needs until we have a merciful engagement first," close quote. Keenan's insight reinforces a theme of Pope Francis, which is the importance of human encounter and connection. Francis's emphasis on mercy remains timely because it calls one attention to the other, when so much of what captures popular attention, especially in connection with technology and AI, can abstract from the reality of human suffering on a global scale. For John Sobrino, mercy demonstrates Jesus at his most human by directing one's attention to the reality of human suffering. Sobrino reflects on mercy as a principle rather than virtue. The principle forms an original part of the salvific process that was experienced through Jesus's action in history in response to the suffering of others. The principle of mercy establishes a common framework for beginning to understand God's relationship with humanity, experienced in Jesus, and the way in which human beings ought to see one another, with mercy. As a virtue, mercy is a habituated act of responding, and for Sobrino, it forms a prioritized way of seeing the world as Jesus did. Jesus is God's mercy in person, which comes to the world and approaches human beings concretely and physically, touching them in their temporality and their flesh, that they may trustingly and unconditionally deliver themselves over to that same action of God and be transformed into what God is, mercy. Mercy as a principle offers a point of orientation, a place from which one begins to consider how to respond to a particular situation. Once a starting place has been established, then habituating responses that are attentive to suffering might become easier. The principle of mercy may be better described as a praxis of mercy, the place where right thinking and right action become habituated by entering into the suffering of others, emphasizing both mercy as a principle and a virtue. When considering the uses of AI, the importance of human connection and responding to human suffering can become difficult to see. Within a few years, the use of AI has promised to reshape the operation of many industries, including healthcare. However, most research within the area of AI and health has been done to test the functionality of AI. In other words, did it do what it said it was going to do? As opposed to whether AI had a benefit for the intended implementation, patient outcomes, reducing clinician burnout as two examples. While technological function is essential, when discerning whether to implement new technology to address a problem facing Catholic healthcare, mercy draws attention to the importance of responding to a human need. When making the decision to adopt new AI technology, Catholic healthcare should make the decision in light of the characteristics that define the healing ministry. Discernment models are prevalent in Catholic healthcare and serve to provide guidance for complex decisions that affect the business of healthcare and the ministry it seeks to further. AI is different than other systems that are incorporated into the practice of healthcare, such as purchasing new equipment for a particular service. These systems can alter the way in which healthcare is delivered. If AI has the potential of impacting the nature of healthcare itself, especially between the patient and the clinical team, then what technologies are used deserve thoughtful consideration prior to implementation, especially in its initial stages. So I want to propose two theses to kind of guide that discernment process that draws on the understanding of mercy and Jesus's healing ministry. Thesis 1. Jesus' healings are rooted in mercy by engaging the suffering of another. Implementation of AI should reinforce the importance of trust that those in need placed in him and respond in ways that allow fuller participation in the community. One of the challenges of technology is that it can become impersonal, or that solutions arrived at by AI can remain unintelligible to the healthcare team and the patient. It can keep problems at a distance and reinforce the experience of patients as problems in need of fixing. In contrast, Jesus' healings in Scripture, while they may have been to some a display of power, they also demonstrate a relational dimension that proves essential to healthcare, inclusive of the technology being used. In many of the encounters that take place in Mark's Gospel, there is a conversation. There is something that Jesus wants to know about the other as a part of this exchange. Yet in discussions of AI, a complacency can exist that relies on what the AI knows or generates. Understanding the disease, the knowledge to treat it, and the experience of the patient is essential to good clinical care. Thesis 2. Decisions rooted in mercy begin from a place that, like Jesus, considers first the suffering of individuals and communities that remain central to the ministry of Catholic healthcare and should benefit from the integration of AI into health systems. Directive number 3 of the ERDs emphasizes a commitment to those marginalized in society that makes them more vulnerable to discrimination. Patients, when entering any healthcare setting, are already vulnerable. They participate in a relationship that is inherently unequal. Catholic healthcare's commitment to focus on caring for vulnerable populations should first consider how their needs can benefit from the integration of AI into their care. One of the more well-established ethical concerns, both of the ethics of AI and healthcare, is the inequalities of society are reflected within the healthcare setting. Given that Catholic healthcare's commitment to the poor and vulnerable populations, the ministry tends to see those patients that are often uninsured or underinsured and less able to access healthcare at other systems. How can AI be utilized in a way to ensure an equitable standard of care when being seen in Catholic healthcare? It is important that newer technologies offer an opportunity to be used in a way that benefits vulnerable patient populations and does not just benefit from the use of the patient's data. The mission of Catholic healthcare is reflective of the ministry of the Church, both in its capacity to heal those seeking care and by demonstrating that those who receive treatment have equitable access to the highest levels of care. The integration of AI should enhance the care of all, not just for the benefit of a select few. The pressure to integrate AI technologies into healthcare is only going to increase in the coming years, and it's important that health systems develop strategies and processes to decide why and how to implement them, and who are the best individuals to make the decisions within the ministry. For Catholic healthcare, the priority should remain to serving vulnerable populations and communities, and mercy prioritizes that those are likely to suffer the most within healthcare should be at the forefront of those decisions. Rather than relying on the latest trends for analysis, Catholic healthcare can also turn to the foundations of its healing ministry, rooted in human connection, trust, and mercy. Jesus' healings in the Gospel of Mark draw attention to the foundation of a human encounter rooted in response to the suffering of others. It is the trust that those in need of healing placed in Jesus that should remind health systems of the trust that patients place in them. By opening oneself to learn from and enter the experience of another's suffering, Catholic healthcare will be better positioned to understand and utilize technology to respond to those needs. Thank you.
Our next speaker is Laurie Johnston. Laurie Johnston is professor of theology at Emmanuel College and currently visiting professor in the International Studies Department here at BC. A social ethicist, she has written and edited works on moral theology, war and peace, democracy, environmental ethics, reconciliation, and religious liberty. The title of her presentation is The Dignity of Work and AI: Catholic Social Teaching Amidst Industrial Revolutions.
Great. Good morning. I'd ask you to note particularly the S on the end of that title here. I'm going to be talking about two industrial revolutions, and I'm doing that because of Pope Leo's choice of a papal name. Many of you might be familiar with the reason that he chose the name Leo the 14th as a way of doing homage to his predecessor, Pope Leo the 13th, who, and this is a quote from our current Pope Leo, who in his historic encyclical Rerum Novarum addressed the social question in the context of the first great industrial revolution. In our own day, the Church offers to everyone the treasury of her social teaching in response to another industrial revolution and to developments in the field of artificial intelligence that pose new challenges for the defense of human dignity, justice, and labor. So while, of course, a lot of the challenges that AI presents are new, our current Pope Leo's insight is really important, that the challenges of the current moment can be illuminated by looking back at the way that Catholic social teaching, and especially modern Catholic social teaching, emerged in response to the challenges of the first great industrial revolution. This issue, this question of the dignity of work, this is where our tradition of Catholic social teaching began. This is the root issue. The subtitle of Rerum Novarum was on the condition of labor. So labor is a really important lens for looking at this issue now. It's also a lens that can help us see the issue more broadly. Pope John Paul II wrote in Laborem Exercens that the question of work is the key to the entire social question. So in other words, looking at the effect on workers is the key to the overall question of how to promote a just society in the age of AI. So what was Pope Leo XIII looking at when he wrote Rerum Novarum in 1891? These are some of the new things that he identified, the new issues. I'll let you just read them for a moment. So some of these challenges are still with us and are perhaps taking different forms. But one of the things that is shared is that both of these industrial revolutions involve a shift in human agency and power. So the original Industrial Revolution created a situation in which the choices of just a few people could have an enormous impact on the lives of others with a new scale and rapidity that had never existed before. So the order to close a factory might happen one day, and tens of thousands of people could be hungry literally the next day. This was new. Technology could transform an industry virtually overnight. A few people with a lot of capital bailed out the government of the United States at a certain point in history. So all of these are signs of a new kind of human power, a new level of ability to shape society. And if we have new forms of power and new forms of agency, that means we also have new ethical duties. If we are able to shape society, then we have a duty to do that. We're not morally expected to do what is impossible, but as more becomes possible, then more is expected of us. If we are to, as Pope Leo says, defend human dignity, justice, and labor. So I want to start by talking about how human dignity is affected by some of these innovations. And it's certainly clear that AI can support the dignity of work in a variety of different ways. Obviously, by reducing the burden of paperwork and making it more possible for health workers to do the more meaningful parts of their work. Or even in some cases, AI can empower workers to work at a higher level of skill, to do the kind of work that they would not be able to do otherwise. And that can be a profound experience of empowerment. However, there are also a variety of ways in which AI really is threatening to undermine human dignity and the dignity of work. And so I want to remind us a bit about some of these themes in our tradition, especially the idea that work is for humans. Humans are not for work. So one of the drafters of Mater et Magistra said it's of primary importance that the economic world function in such a way that people do not run the risk of sacrificing what they are to what they do. So we are not just cogs in the machinery. We are human persons. And for that reason, John Paul II actually told us that we should not be using the term workforce. He said workforce makes it sound like this impersonal reality when we're actually human persons. Similarly, the term provider has been critiqued recently because it implies merely the delivery of a commodity rather than the formation of a clinical relationship. And so the language that we use really does matter for promoting human dignity, linguistic normativity, as we were just hearing about. So for instance, it's really important to clarify that humans are not simply a form of intelligence and agency that happens to be in a body. And the more human-seeming AI agents become, the more there is a danger that we start to look also at humans as just highly complicated and not always reliable machines. So that's a danger. I encountered recently this term carbon agent, also to refer to the human person, on this website called Rent a Human. So this is a place where AI agents can pay humans to do tasks in the real world, also known as the meat space, because sometimes an AI agent might need to pick up a delivery or make an actual telephone call or something like that. And this site refers to silicon agents as opposed to carbon agents. And while it is true that I am a carbon-based life form, I'm a lot more than that. So I do not like this dangerous illusion of the distinctiveness of the human person. And then there is also the opposite danger of referring to AI agents as almost human. I think we should really not be using human-sounding names for digital agents. There's also sometimes a discussion that perhaps human resources departments might start to be responsible for the digital workforce as well as the human workforce. Again, this is a dangerous illusion. It's hard because we, as humans, naturally tend to anthropomorphize things that seem human to us, but this is something we really have to push back against. So what about the meaning of work itself? How is AI forcing us to think about this, perhaps even in some new ways? Well, work has two meanings in Catholic social teaching. There's the objective sense, i.e. the task or the result. And here, an AI agent may be able to do the task just as well as a human agent. But the more important aspect of work is the subjective sense of work. Who is doing the work? Work done by humans has dignity because humans have dignity. So Antiqua et Nova cautions us against drawing an overly close equivalence between human intelligence and AI because this risks succumbing to a functionalist perspective where people are valued based on the work that they perform, only the objective value of the work. However, a person's worth does not depend on possessing specific skills, cognitive and technological achievements, or individual success, but on our inherent dignity, grounded in being created in the image of God. And that dignity remains intact even in all circumstances, including for those unable to exercise their abilities actively. So what are some of the threats to the dignity of workers that AI is posing? One of them is the new capacity to surveil and quantify work. So we've heard a lot about ambient AI, which might offer a great deal of help to clinicians, but ambient AI is not just listening to what the patients say, it's listening to what the healthcare workers also say. And so it can be used to monitor them. How well do they follow institutional guidelines? How much time are they taking with patients? And do they then describe their work using billing codes that will ensure maximum possible reinforcement? So all of this surveillance of workers that's becoming possible in new ways can really add pressure to the clinical encounter rather than relieving it. And the more work is quantified in these ways, the more we risk losing the focus on the dignity and the agency of the person doing the work. There's also this new phenomenon of Uber for nursing, where some companies have developed platforms that allow health facilities to hire health workers just for an individual shift, and the workers themselves can bid on particular shifts. So this has lots of risks for health workers who are having to report to work in a place they've never been before and maybe not offered any training or orientation. It means patients may have absolutely no caregiver continuity, a different person each shift. And it also, like all gig work, is subject to what's called algorithmic wage discrimination. So different workers using this app may be offered different levels of pay for the same job based on what the app knows about that worker. So some algorithms even incorporate data like the credit score of a nurse to figure out who's most likely to accept this shift at the lowest possible rate of pay. So this is exploiting people who are in more difficult financial situations and taking advantage of that desperation. So work and the dignity of work also comes from the notion that we are created in the image of God, who is creator. So our work is a way in which we imitate God. We participate in that creative action. Antiqua Nova puts this very nicely: shaped by the divine craftsman, humans live out their identity as beings made in imago Dei by keeping and tilling creation, using their intelligence and skills to care for and develop creation in accord with God's plan. So work is good. It can unfortunately become burdensome, but work existed already in the Garden of Eden, right? We're commanded to keep and till. Adam was given the creative task of naming all the animals, right? So work is something that under the right conditions is a participation in the creative activity of God. And this is a key point that really distinguishes Catholic social teaching from some of the utopian visions in which AI makes work no longer necessary. That's not the world that we're looking for from the perspective of Catholic social teaching. Yes, it would be good if work is less burdensome, if it is not drudgery, if it's more meaningful. But work is, as Laudato Si puts it, part of the meaning of life on this work, a path to growth, a path to human development and personal fulfillment. And even when our work is really difficult, it can still be good work that participates in God's plan of salvation. And in fact, the harder the work, perhaps the more redemptive in some circumstances, not if it's drudgery, and this is part of why the greater the temptation is to rely on AI to help us with difficult work, the greater the risk of de-skilling, of course. But also, we need to do hard things in order to develop our capacity as humans, realize our potential, and contribute to the kingdom of God, ultimately. Work is also a way in which we're supposed to be creative. So we're created in the image of God, who is creative, and AI itself is a product of human creativity. And of course, there's lots of creative ways to use AI, but its effect is often the opposite of creativity because algorithmic logic tends towards homogeneity, tends towards a flattening kind of conformity. We don't often think of clinical judgment as something that requires creativity, but it absolutely does. The clinical encounter, any form of caregiving, because it's interacting with another human person, requires improvisation, creativity, ingenuity. And that in turn requires agency. You can't be creative in a situation in where you lack agency. And this is a very important challenge that AI poses when it threatens to compromise some of our own agency. That's also a risk factor then for moral injury. The sense of being prevented from acting as one ought to is the fundamental cause of moral injury. And so anything that undermines our sense of freedom or ability to act risks creating greater moral injury. Then we're created also in the image of a God who is Trinity. And so part of what work is a way that we express our relationality as social creatures. So again, Antigua Nova says, the relational orientation of the human person is ultimately grounded in the eternal self-giving of the triune God. Work is an essential dimension of social life, etc. The biggest way in which our tradition relates work to our social nature is by saying that humans have a right to join a labor union. This is a really crucial idea in Catholic social teaching, and I'm continually surprised that so few workers in Catholic health organizations are part of unions. This is especially, I think, important because in the age of AI, we need collectives like unions, not only unions, other collective organizations that can help us push back against some of the challenges that we face. I'll let you just read through these. And finally, the question I think that this leaves us with is that work is changing, but how can we make sure that we find ways to live with AI that don't undermine human dignity, creativity, and relationality, so that we can all have meaningful work that participates in the creativity which God intends for all of us? Thank you.
Our next speaker is Andrea Vicini of the Society of Jesus. He is chairperson, Michael P. Walsh Professor of Bioethics, and Professor of Theological Ethics in Boston College's Theology Department. Medical doctor and pediatrician, he has published widely in fundamental moral theology, theological bioethics, global health, environmental issues, biotechnologies, and artificial intelligence. The title of his presentation is AI in Healthcare, Environmental Challenges.
Thank you for the opportunity of reflecting together on AI in healthcare, and I contribute focusing on environmental challenges. AI technologies in healthcare are promising. As Amelia Katirai argues, quote, "The promise of artificial intelligence in medicine is to provide composite, panoramic views of individuals' medical data, to improve decision-making, to avoid errors such as misdiagnosis and unnecessary procedures, to help in the ordering and interpretation of appropriate tests, and to recommend treatment," close quote. For others, while, quote, "AI offers tools to optimize hospital operations, such as predictive maintenance, resource allocation, and patient flow, its widespread adoption demands vast computational resources. These requirements result in significant energy consumption, CO2 emissions, fresh water use, and electronic waste. Data centers essential to AI functionality contribute notably to global electricity use and water stress, especially in areas already facing environmental constraints." End quote. While appreciating how AI technologies may contribute to providing quality healthcare, focusing on their environmental effects highlights a more disturbing reality. I briefly describe 8 environmental challenges, which are structural, we could say systemic, and I will end by arguing for urgent responses. So first, let us examine these environmental challenges. Ethicists unveil the environmental implications of the ongoing implementation of AI technologies. For Noreen Hertzfeld, quote, when AI technologies integrate into the wider society and become the standard for most of us, they will rapidly deplete our energy resources and exponentially accelerate the warming of our already overheated planet, close quote. She continues, quote, these technologies might well doom humanity, not directly through their decisions, but indirectly through our decision to use them at the expense of warming the planet. Artificial intelligence is a hazard to Earth's ecology, close quote. A few aspects deserve attention, beginning first with server farms. As Hertzfeld highlights, quote, the data is stored in massive server farms, often built in rural areas. Companies such as Google, Amazon, Microsoft, and Meta have placed millions of square feet of server space in rural Virginia, California, Texas, Washington, and Oregon. These centers count on cheap land, cheap electricity, and tax incentives from dying small towns looking to attract capital. They are part of a long tradition of appropriation of rural resources for urban development, close quote. Second, quote, in terms of CO2, a study from the University of Massachusetts Amherst found that the energy used in training a typical AI linguistics program emits 284 tons of carbon dioxide, 5 times the lifetime emissions of a mid-sized car, or equivalent to more than 1,000 round-trip flights from London to Rome. And this is only increasing. As deep learning models get more and more sophisticated, they consume more data. The carbon footprint increased by a factor of 300,000 between 2012 and 2018. If data centers were a nation, they would place in between Japan and India in the amount of energy they use in a year, close quote. Third, regarding energy consumption, quote, in the United States, data centers already account for more than 10% of electricity use in at least 5 states. In Ireland, they consume more than 20% of the entire national electricity supply, end quote. Furthermore, despite the urgency of addressing climate change challenges, utilities abandon renewable energy efforts and revert to relying mainly on fossil fuels. Hence, quote, if the trend follows the current trajectory, the increasing use of AI in healthcare will undermine several United Nations Sustainable Development Goals, including healthy lives and well-being, clean water and energy, affordable and clean energy, and climate action, end quote, with implications for today's citizens and for future generations. Fourth, water consumption should also be considered. As Hertzfeld stresses, quote, while companies such as Google have promised that these data centers will be energy efficient and environmentally friendly, they rarely mention the billions of gallons of water needed to run the air conditioning that keep these centers cool. Given their large land and noise footprints, many data centers are built in desert or semi-desert locales, that is, in areas already experiencing high water scarcity. In Red Oak, Texas, south of Dallas, in 2020, Google has requested up to 1 0.46 billion gallons of water a year for a new data center. And legal data shows that they have been promised 1 million gallons a day to cool a data center in Mesa, Arizona, and up to 4 million if this project hits its milestones, close quote. Whitney Simpson adds that, quote, the decrease in water availability could limit food production due to the water resources directed toward AI systems and away from agricultural production. Thus, the impact of AI's water consumption extends far beyond the natural environment and may impact important social thresholds with major health implications, end quote. Hence, quote, many communities risk being in competition with data centers for water access, close quote. If one considers that in its 2024 global report on water scarcity, UNICEF stressed that, quote, 4 billion people worldwide experience severe water scarcity for at least 1 month per year, and close quote. The environmental consequences for human health and for the whole planet are troubling. Furthermore, quote, during the production stage of AI's life cycle, a large amount of water is required to manufacture AI microchips and servers. This use implies that AI generates wastewater from both server and chip manufacturing and data cooling centers. This wastewater often contains a range of pollutants, and if untreated, can negatively impact the environment by contaminating local water supplies and degrading aquatic habitats. These discharged waters can be reused, but they require significant additional processing to avoid toxic chemicals and hazardous waste contamination. However, water recycling in many cases is still very low, close quote. Fifth, e-waste needs to also to be addressed. In fact, quote, e-waste threatens the environment because electronic devices are a compound of hundreds of different substances, many of which are toxic. The main problem is that roughly only 17% of global e-waste is documented to be collected and properly disposed of or recycled each year. Unfortunately, when e-waste is improperly disposed of in informal recycling sites or landfills, the harmful substances in the electronic devices can leach out into the soil and surface water. As a result, there is a significant risk of these toxic substances migrating to underlying groundwater aquifers. This type of water contamination brings multiple human health and ecosystem risks. For example, substances in e-waste may contribute to neurological damage and even cancer. Additionally, these substances can survive for decades in the environment, leading to declines in biodiversity, especially in vulnerable aquatic habitats, close quote. 6, air pollution is a further concern. The backup generators that ensure uninterrupted power also pollute. Hence, while data centers often receive substantial tax breaks, local residents find themselves living next to industrial complexes that operate around the clock, creating unwanted noise, traffic, pollution, and infrastructure impacts. So we can also list noise pollution among the forms of pollution that we experience. 7, quote, the extraction and processing of metals for the production of essential semiconductor chips and the accumulation of e-waste from rapid hardware turnover further compound the environmental footprint of generative AI tools, close quote. Eighth, there is no transparency regarding the costs of developing and using AI. The higher electricity bills, health impacts from air and noise pollution, and water scarcity are being externalized to communities, while profits remain in corporate hands. Moreover, health-related costs that account for the full range of health impacts should be examined and highlighted. In particular, quote, the environmental footprint of health AI risks causing more asthma exacerbations, acute respiratory infections, deaths from heart disease, and overall mortality, akin to the well-documented negative health impacts of traffic-related air pollution on human health. The widespread calls for locally and globally just health AI deployment thus require accompanying environmentally sustainable practices, focusing on the needs of populations that have been historically disadvantaged and underrepresented in the development of this technology, close quote. Now I end with the critical assessment. Critical analysis of the AI environmental footprint in healthcare is urgent. It is necessary a rigorous evaluation of opportunities, possibilities, and uses of AI technologies in healthcare to ensure long-term viability of healthcare practices and sustainable structural changes in healthcare institutions. The environmental consequences that accompany these technological developments should also be identified. The burden of reducing these consequences should not be on healthcare institutions, but on the corporate sector that is developing AI technologies. Research on ways to reduce and possibly eliminate the environmental impacts of AI, such as fresh water usage, energy consumption, and e-waste, should be fostered. Monitoring strategies and regulatory efforts are also needed, from applying existing laws to new laws and regulations. For example, in the US, quote, a federal rule should require AI developers and companies to accurately measure the carbon emissions of their AI throughout its life cycle and disclose those measurements to the public via periodic reporting, close quote. A compounding ethical concern is that the ongoing and increasing consequences of climate change already show an unequal and inequitable distribution of disease burden affecting socially and economically marginalized population. As Paul Farmer always repeated, diseases make a preferential option for the poor. Concrete actions are needed to reduce the negative environmental impacts of AI technologies by making a preferential option for those who experience these negative effects. Adopting sustainable practices should be an ethical priority, while affirming that, quote, in certain situations, the higher energy consumption cost associated with deep learning may be appropriated because of the complexity and clinical importance of the task. Providers should favor AI applications with proven clinical benefits and lower energy needs. Health system leaders can scrutinize the footprint of their computational infrastructure, incentivize environmentally sustainable practices across the supply chain, and promote health equity by anticipating, measuring, and mitigating disparities related to AI deployment. Policymakers, locally, nationally, internationally, should recognize the risk of unconstrained health AI expansion to marginalized populations and reshape global markets so that they align with social needs rather than solely corporate profits. Close quote. Finally, the allocation of limited resources requires careful assessment by considering that, quote, market forces are central to the expansion of AI, with more than $1 trillion in international capital investments forecast within this decade. By comparison, fewer than 20 countries have a gross domestic product exceeding $1 trillion. Public and private capital is flowing heavily into the development of generative AI models, dominated by an oligopoly of technology firms. This disproportionate resource allocation to AI represents a substantial lost opportunity for addressing key social determinants of health, such as education, housing, and economic stability. Close quote. My conclusion. As Benedetta Brevini stresses, quote, without challenging the current myth of limitless economic growth and boundless consumerism, without reconsidering the way in which the structures, the violence, and the inequality of capitalism work, we won't be able to achieve the radical change we need if we are to tackle the climate crisis, close quote. Societal and economic incentives are not always aligned with societal and environmental needs. Hence, the transformation of the current economy into one that is good for humankind and for the planet is the ethical task that people of goodwill should embrace. AI is considered a social good, quote, without sufficient recognition that what is good may be defined differently depending on one's position in society, and that even AI developed for such good purposes may simultaneously have harmful outcomes, close quote. Hence, social biases and inequities should be recognized and avoided. Healthcare structures and their dynamics should also be assessed. As Daniel Daly reminds us, structures should be virtuous. That is, they should, I quote, should be socially rooted moral habits, willingly internalized by moral agents that consistently prescribe the human good, the common good, good moral character, and human happiness, close quote. Technological development should be at the service of what is good for all citizens everywhere. Technological progress should be a further opportunity to foster the common good, which is, quote, the sum of those conditions of social life which allow social groups and their individual members relatively thorough access to their own fulfillment. That is, individual and collective flourishing by encompassing all social goods, spiritual, moral, relational, and material for all human beings, end quote. As Michael McCarthy, Mary Ullman, and Michael Roger have stressed, quote, the common good becomes a more urgent question and requires special consideration from the perspective of those pushed to the margins of society and our clinics. Using a Christian anthropological approach, persons are called to look at the world from the perspective of the marginalized and to recall the relational dimension of human dignity, end quote. Hence, quote, now it is the time for the healthcare sector to bend the trajectory of AI toward environmental sustainability and social justice, close quote. Thank you.